Hi, I'm Dr. Sachin Jadhav. I'm the group head for hematology and bone marrow transplantation for HCG group of hospitals, and I'm based out of Bangalore. Blood cancers are very prevalent, and increasingly more and more patients are getting diagnosed. Whether that means that the number of patients and the disease itself is increasing, or it's just that because the healthcare is better, more and more patients are getting diagnosed, we really don't know. In general, if you see in the world, the data that we have from more developed countries shows that blood cancers, which are leukemias, lymphomas, and myeloma, right? These three are primarily the blood cancers. So if you total up, then for every lakh of population, there are 40 new patients every year on an average, which means that in our country itself, about 5 lakh new patients are diagnosed with blood cancer every year. How we compare with the rest of the world, we are really not sure. We are not aware because there is no hard data from our country. But broadly, we can say that about 5 lakh new patients are diagnosed every year in this country with blood cancer. Quality obviously impacts the success of treatment because blood cancer is not really managed by just the doctor. And it is not really to do with just infrastructure or technology or medicines. We have to put everything together. We have to have good doctors who follow standard protocols for treatment, which means that some doctor can't say that, I know how to do this patient is to be managed in this manner, without really paying attention to what is being done in the world. So it's not just the doctor, but how the doctor works. Similarly, nursing has to be standardized. So nurses have to be trained, they have to go through training for a minimum of 6 months and maybe even a year or more. And then their experience in managing such patients. Then, of course, there is the quality of infrastructure, the rooms, the air which can cause infection, the water and the food which can spread infection. We need to understand that patients with blood cancer or those who are undergoing a bone marrow transplant, their immunity is seriously compromised. So you may have a wonderful doctor who does everything, but if the water and the food and the air is not clean, the patient's life can still be at risk because of infections, right? So we pay a lot of attention to infection control policies, and we have teams and training, and we believe that this is really what is required because this quality of care impacts the outcome and the success of treatment. It's a big challenge. It's a big challenge because hematology and bone marrow transplant is a new specialty. Most of the hospitals and doctors and nurses and infrastructure facilities in India are not really proper. People don't know how should the room be designed, how should the air be filtered, and how should the filters be monitored. Doctors have access to the best of medicines, but how should this medicine be mixed and given? There is a major shortfall in this knowledge base and standardization of quality and protocols in our country. Now, when we trained abroad, it was very clear that everything is structured, everything is defined, and everything works as per a particular quality plan and protocol. And that is the difference between India and the developed countries. Doctors are there, medicines are there, but other things are not really in place when it comes to this specialty of hematology and bone marrow transplant. HCG is uniquely positioned in cancer care. We have a network of over 20 centers across India, Southeast Asia, and Africa. We have centers which are committed to giving the best patient care and to giving the best success of treatment. With this commitment, what we have done is in this department of hematology bone marrow transplantation, we have started from Bangalore, and we have put together a team of doctors, we have put together a team of nurses, housekeeping personnel, infrastructure, etc. And we've created a model. And this model is being replicated across our centers in India today. So, our center in Nasik, Nagpur, Mumbai, Jaipur, Kolkata, all of these are getting aligned with the quality plan. All of this ensures that we are able to provide access to quality care in the smallest tier 2, tier 3 cities of this country. We want to ensure that any patient in this country as well as in Africa and with our upcoming centers in Southeast Asia will have an HCG center nearby where they can expect the best chance of success for the treatment of their blood cancer, thalassemia, sickle cell anemia, bone marrow transplantation, all of that. So essentially in HCG we have created a program for providing access to quality care and best success of treatment to patients in their neighboring city.